Stan, I guess the CBO is going to rescore. For our global audience and for our American audience, do you trust the CBO math, and can they rescore over the 4th of July weekend?
Well, first of all, yes, they can. Second, yes, I do trust them, probably more than any other organization that does budget scoring in Washington or almost anywhere else. Their only job, CBO's only job as a nonpartisan organization, they work for the Democrats, Republicans, House and Senate all at the same time. Their only job is to get the numbers right, so they're doing the best they can. Now, is it going to be precisely correct over 10 or 20 years? No. No one's will be.
Right.
But they'll be closer to almost anybody else.
We talked to Kevin Cirilli about the pork that's out there, some 200 billion large. Forget about that. We spoke to the head of New York Presbyterian Hospital yesterday, and I asked him about $6,000 or $5,000 deductibles. I asked him about people making $38,000 a year, and what do they do? Will this reset of Republican health care affect those deductibles? Will it affect those premiums?
Well, if they do what they want to do, which is to cut the taxes that were included in the Affordable Care Act, there's almost no choice but to do those types of things. That is to eliminate or reduce subsidies, to and to come up with savings in a variety of other places. That's what makes this bill so difficult, which is, as Kevin was mentioning, he and I were talking about before we went on air, Medicaid is an enormously popular program, not just with the poor, but with the senior citizens and with their children, who think that if they don't have to, if it doesn't exist, they will end up paying for their parents. So to make it unaffordable for a variety of people to get health care, to cut Medicaid, is almost a political non-starter.
Within the zeitgeist, I think of Mike Allen at Axios, but it's over at Vox with Ezra and all the rest, is this idea of Republicans as conservatives. Are they acting in a conservative or libertarian way, whatever you want to flavor it, or is this something new and original from Republican leadership?
No, there's nothing original about it. I mean, first of all, they've been talking about eliminating or repealing or replacing Obamacare for 7 years. So there's nothing new or creative about it. But this is, as much as anything else, this is a decision to try to tear down what the previous president did because of the base's feelings about him. There's very little here having to do with health care reform or actually making health care more available or more affordable. If they did, they'd be talking about a single-payer system, and that's just not in the cards at the moment.